Great. Hoping to give you a good sort of story about where we are, what we're about. So we've been around for just over 10 years. Originally came from spin out from Oxford University. We've grown since then. We're just over 150 people now. Oxford, Cambridge, London, Boston, and opened office this year in RTP. We continue to grow, continue to hire the very best talent available in the world. And people sort of say to me, David, genomics, what's it about? It's about being the very best in the world at understanding genomic data, understanding what that means, understanding how we can use that in two very distinct ways. One, to help human health individuals. I'll touch on that in a minute. Thank you for the warm-up. And a little bit in terms of sort of bringing data together. Genomic data is very complex, but harmonizing it, ingesting it, bringing it together, and then using it in sort of an in silico way to basically drive the next generation of drug development. So that's what we're about. So, and I kind of split this in these two very distinct sort of sections. So we work with some of the largest sort of pharma companies in the world. We support them in the drug discovery and in the target validation. It's a significant addressable market in this part of the world. You know, there is life science companies spend billions of dollars on R&D. If you apply human genetics to research and development, you are 2.6 times more likely to get your drug to the market. And thank you for the nodding head. So it's proven, Nelson et al., if you want to look it up. So it's a significant difference. The average cost of taking a new molecule to market is about $2.5 billion. So that is makes a significant difference to getting best-in-class new therapies into the hands of patients. It's one half of our business. On the other half of our business, we work very closely at an individual level. So, and I'll touch on what polygenic risk is in a minute, but we're very, very good at understanding how you use genomic risk at an individual level to basically create better outcomes for people. We can do that at scale, population health level in the UK. We do with people like Our Future Health, working with people like the NHS. But we can also do that at scale across big American systems as well. So, a little bit of science, not as complex, hopefully, as some of the other science. So we talked about the artificial intelligence revolution, we've talked about big data revolutions, and underpinning all this, but it's also been through this large genomic revolution. So over the last 20, 30 years, from that very sort of unpicking of the human genome in the first place. Some of you might remember the Bill Clinton big story. But since then, we've got very, very good at understanding human genetics. So 10 years ago or so, if you took a tiny bit of your DNA, you'd actually find something medically actionable about 1% of cases. So you do that. People are familiar with this, cystic fibrosis, Huntington's disease, things like that. So it's a single variance. You talk about a single variance, some of these kind of, that kind of stuff. What we did and understood is that if you take a lot of variants, so up to 1 million different variants, and then apply that to common diseases, you can actually look to see what your genetic code causes in common diseases. So we call that polygenic risk. So now we can give you actionable insights in 70% of cases. We can tell you and predict the likelihood of what disease type you're going to get. That's pretty cool. It's quite exciting. And then we went one step further. We went, okay, what about if we integrate that and give you both your risk or your genetic risk and apply that to your common risk? So if you're going to a doctor at the moment, and if you're going to see a GP, they said, oh, your risk score for this is this, for diabetes, your risk score for heart attacks is this. So we use proprietary algorithms, artificial intelligence, we merge them together, and we give you an integrated risk score. Little chart, let me try and explain what this means to you. Basically, the variation in your genetics makes a massive impact to your likelihood of getting common diseases. Here's some good news, bad news stories for you. If this is you, this is coronary artery disease in men, slightly different for women. You are 20 times more likely if you have bad genetics to get coronary artery disease as if you have good genetics. The blue, good, red, bad, green in the middle, average. So it'd be good to know that, right? If you knew that, you could take action, you could go on statins, you can intervene, you can actually make an impact in your life. That's part one. Here's the other kicker as well. Actually, if you're unlucky enough, you've got the bad genetics, it affects you earlier. Okay? It's going to affect you earlier in life. So you want to take medical action, or want to take interventions earlier when you're in your 40s, in your 50s. So this is just coronary artery disease. We apply the same thing across a number of common diseases, which I'll touch on in a second. I lost my slide. Oh, they're not there. Doesn't matter. So what we do here, so we then take these risk scores, and we then apply them to actually, and we roll those out across both the US and the UK. So in the UK, We've got an MHRA registered test. So that means that it's been approved by the regulator over here, and we return that through a number of clinics. It went live just this quarter. So it's available through Bupa, through Spire, and that's been available through aspects of our Future Health as well. So that will then show you what your likelihood of you getting the risk of these common diseases are. So we use that for breast, prostate cancer, diabetes, coronary artery disease. In the US, again, registered test across the US. It's available all over the US, all the states across there, places like the Cleveland Clinic, Mount Sinai, Stanford, all across different areas. And again, we return those tests to individuals. This test goes back to you through a doctor. A healthcare professional comes back to you, but it's about risk. It's not about common variants. So that's part one. I think that's quite cool. What's really great about my company is that we've got really, really smart geneticists in there. And they really, really understand what actually genetics actually means to you as individuals. So then we took all this work around doing this at individuals and went, right, what happens if we applied this to some of the biggest challenges out there? What happens if we try to discover new diseases? So we have taken around the world about 40,000 different genetic data sets, harmonized them and ingested them into one common platform. That's a significant lift. If you think of it, each one of those 40,000 I talked about has multi-million data sets underpinning it. So we brought them all together under one umbrella. And the real complication around this is not just the bringing them together. It's pretty easy. It's about sourcing them, identifying them. It's a 10-year lift behind that, but it's then about making sure you can actually query them at pace. For an idea of what I mean about talking about querying at pace, I demoed this platform to the chief medical officer for AWS yesterday, working in partnership with them. And he said, that's really good. That was my 3-year PhD that you just did in about 3 seconds, David. I'm like, yeah, yes, wow, that's a game changer. So there's an absolutely amazing pace to take something which took 3 years to 3 seconds, but that's 10 years of work to get there on that journey. So I would say this, it's all about this move to sort of this in silico drug development and actually doing this repeatably at pace and going back to that 2.6 times likelihood that I talked about before, and very much about having this underpinning sort of powerful data set. We've worked in conjunction over the last year very closely with AWS and Deloitte to ensure it's scalable, that it's available anywhere in the world, but also that it's protected. We're talking about very complex, unique data sets here. We want to make sure they're securely looked after, they sit in the right geographical jurisdictions, sit in the right places. We very much execute on that. Do you want to do some financials? People like financials? Okay. So high-level financial stuff. We've been around for about 10 years. I had our board meeting yesterday to preemptively answer a question with a really supportive IP group and on our board. He's absolutely wonderful. Sounds great. This year, we're growing about 111%. It's the last board meeting. I think we'll end this year at about 150% year-on-year growth. We expected the same next year. We're EBITDA positive end of this year, and we'll do about $70 to $80 million of revenue next year. So that's sort of where we are. Happy to take any questions.